Dr. Keeli Gailes is a physical therapist, a wife, and mother, as well as the founder of Health for the People. Health for the People is the result of a deep belief that Americans are capable of great things when we find common ground and put our heads together, and that finding a solution for healthcare is not beyond our capacity. Its necessity has been reinforced by her personal experience as a patient, a caretaker, and a clinician. Keely, please tell us about Health for the People.
Hi, everybody. Thank you, Dawn, for that wonderful introduction. And I have to say thank you to Athena as well for setting all of the beautiful groundwork. I believe that our work overlaps a lot, and I look forward to meeting with you at some point after today. So my story is that I'm a physical therapist, and while I was in my graduate training program, was when my eyes were finally opened to all of the difficulties that we really face as a healthcare system. And I couldn't believe that I hadn't really confronted it until that point. So that spurred my capstone project, which has now turned into this nonprofit organization called Health for the People. And it looked a lot like what Athena's trying to do right now when the concept first started. And it has morphed since then in the last 8 years or so into a little bit more specific plan to attack the plan, if you will, for what could healthcare look like in the future. So I don't know about you, but I'd like to have a little bit more than a concept of a plan to move forward with. And I realize that we live in such a heavily divided country that the thing that has really impeded our ability to make progress in this arena, in large part, is public opinion and understanding of the true issues and why we are not making progress. So I think a big education component is necessary for the masses. And I'm hoping that work like what Lonnie has been discussing with reaching out to organizations who are treating patients that have a lot of Medicaid is going to be a part of that solution as well. But what our organization is doing is really trying to create a space where we can specifically focus on talking about what do the pieces of that plan look like in a way that breaks down silos by creating different, I hate to say silos, but different organization of thought, right? So rather than having all of the ER docs in one room, what we do is we take somebody who represents emergency medicine, somebody who's a pediatrician, somebody who's a nurse and a PT and a lawyer and an accountant and a patient experience representative, and put all of those diverse perspectives in one room or one space to talk about a specific issue. And it might be like what Lonnie's working on right now, like Medicaid, but in my goal, it would be more talking about those things as near-term solutions, but also really focusing on if we had that pie in the sky or as close as we can reasonably expect to get to that in this country, what pieces could we put in place to make that the most successful? So if you go to our website, healthforthepeople.org, you can find the plan that I've put together through a lot of listening work. And that listening work occurred over, a number of years, just seeing what is out there that is working, whether it's domestically or abroad, that could solve for some of those big issues that we are encountering in this country. Because the truth is that the solutions already exist. We just aren't doing a very good job of implementing them. And in places where they are being implemented, it's small region, right? It's on a smaller scale, whether it's a city or a state or a clinic level. And I want us to expand on how do we take that concept and make it something that could be feasible nationally. And like both of you have said, right, we need that group think. We need diverse perspectives in order to take this mountain, right, and start to make it into a molehill. Because the truth is, it is going to be incredibly difficult to reform our healthcare system because it is deeply entrenched. But that does not mean it's impossible. And I think that what we have to recognize is that healthcare affects every single one of us. So we want, sorry, Susie made a comment that made me laugh. What we want is to take the concepts and make them small enough, but while not losing sight of the end goal, right? How do we work together to attack each of these individual issues. And so we need to work with organizations who are already doing this work. My goal is to be able to bring in people like Athena, like Lonnie into this space and let them find their niche and have those conversations around a concept that will help us start to flesh out what is the best way to attack each and every one of those topics. Now, I have put forth, I believe it's about 15 solutions, if you will, that mostly I did not come up with. There's a couple that are somewhat my brainchild, but as anybody who's ever thought they came up with anything recognizes, somebody probably did it and you just didn't know it, right? My concept really, though, is that they need to be implemented either at the same time or in a stepwise process, because without one of them in place, many of the others don't really work. And that is the hard part, is recognizing which of these have to be implemented at the same time, and how do we work the system, right? Like, who do we need to know to figure out how do we actually work the existing system in order to be able to get these what should be common sense solutions to move forward. And so I've been networking with people like Rick Mountcastle and Denise and Todd Otten and everybody over the last few years, trying to get to that point where my network is broad enough that I can bring in those creative minds. And that's still my ask today, right? Is that we really still just need people. I will be very transparent in that over the last year, I have become a parent once again. And so my work has taken a little bit of a slump as I was preparing for having a baby and had the baby. And the organization has shrunk to some extent as well because we were female led. And unfortunately, in this country, we don't have the luxury of having paid maternity leave. And so we really need people who have, either or time or treasure, right? Whether you can, we need at least one board member. And we really need volunteers or people who are just interested in collaborating in the space to get the conversation going. Just as Athena was saying, right? It's all great to have this space, but if there's no people in the space having a conversation, it doesn't get very far, right? So that's why I show up to meetings like this. And we need more people who are willing to just do that, just keep connecting and bringing people in. There's always other work to be done, and whatever skill set somebody has that's interested in working with us, we can always find a way to put it to great use. We'd love to meet somebody who has some legal acumen, as well as financial backgrounds. If you know anybody who has a passion for the kind of work that we're doing, you can learn more about the specifics of our projects on the website. We do have a local initiative as well to try to get some resources directly to the people who need them in our community. But the fundraising we've done to date has often been earmarked toward that cause. And so it does make it difficult for us to get like the national campaign moving forward when most of the money that we have, people just want to see it go to help one person in the community. And I hate to poo-poo that because it is important to be treating people on a local level. But if we don't do something about the big picture, we're not going to have the small picture that looks anything like what we expect it to look like, in my personal opinion, in the near future. So if you're interested, I ask you to reach out. I'm happy to share any and all of my contact information and figure out a way that we can collaborate and make each other's work more sustainable and easier. So thank you so much for your time, and I hope I answered all of those points. Feel free to ask any questions when we wrap up here.
I for sure heard your ask, and
What can I
I want to
offer?
make sure, I just want to make sure that you have a chance to say that,
Thank
to
you,
make
Dawn.
sure that's clear to people.
Yeah, what I can offer is what I have done so far, right? So I have done a ton of listening work and I love to talk. So if anyone's at a point where they're trying to figure out are there point solutions for specific things, if you see that I've touched on it in my outline, I probably know other organizations that are connected to that particular thought process. And I can tell you where that came from and maybe point you in the right direction of more resources. I'm working with one organization right now as an expert, as a physical therapist who does pelvic health, just to help them vet people who might be providers for their organization. So any way that I can help, I'm always willing to help. And if there's anything in my background that makes you think that I might have a skill, please just reach out and give me the ask. I like to be a connector, and I don't have quite the extensive background that Lonnie does, so I don't know that I'm as good at it, but I never am unwilling to reach out to someone. If I have to cold call them, I will cold call them to make things move in the right direction. So please just always ask.